Finally, in Better Health, we take a look at the importance of Cervical Screening Awareness Month.
Hi, I'm Paula Parker and I'm the team leader for the National Cervical Screening Program across the Southern District. My role includes managing the National Cervical Screening Program register and health education across the Southern District.
Kia ora, I'm Wendy Raumati and I'm Screening Advisor for the National Cervical Screening Program. It's a really great job. One of my roles is to support practice nurses and the woman to have their cervical screens, and that's having a smear.
The screening is done by primary care mostly. So women, when they're due for a smear, they go to the medical centre and have their smear.
A smear is actually the best protection a woman has against cervical cancer, so it's really important that women have their regular 3-yearly smears. In New Zealand, Māori women are actually at a higher risk of developing a cervical cancer. The reason for that is they're not going and having their regular smears.
So all women who have ever been sexually active should have regular smears from the time they turn 20 until they're 70 years of age.
A lot of women have barriers or different reasons for not having a smear. Some of them could be cost, some of them could be whakamā or embarrassed and ashamed. My message is to all women: have your regular smear, it could save your life. If you have a barrier, if you're not sure, talk to your doctor, talk to your smear taker, ring the 0800 number and see how we can help. 0800 729 729.
Kia ora koutou katoa, Victoria Bryant toko ingoa. I'm Victoria Bryant and I'm the Charge Nurse Manager of Public Health Nursing in Otago. I've been successfully running the HPV vaccination program since 2008 in Otago, and the vaccination is to protect against human papillomavirus virus, and it's commonly called Gardasil or HPV vaccination.
I'm Natasha Roger. I'm a public health nurse for the Southern District Health Board, and I coordinate the school-based vaccination program of HPV in Otago. So I guess really my main role is quite to do with coordinating the schools, dates of vaccinations for the girls, and of course team leading at each school on the day of the girls' vaccinations.
It protects against cervical cancer and genital warts.
Okay, so basically the school-based program is offered to Year 8 girls, and we coordinate 3 dates for each school over the year. So the vaccination's given, for us this year we started in April, we go back in May, and then again we're due back in October.
The vaccination is available to 12-year-olds on the immunisation register, and also Year 8 girls in schools. It's also available free up to the age of 20 for young women.
At the beginning of each year, usually February and March, myself and some other nurses will go into schools and we deliver education programs. So that would either involve, depending on the size of the group at the schools, a slideshow presentation, we have a DVD on offer to show, or just a general sit-down chat if it's quite a smaller group of girls. We provide just an overview of the program, what cervical cancer is, what vaccination we give, and then of course we provide the consent form, and on that also provides a lot of the information which they then take home to their families.
And it's a great thing to protect against. It's really important for our future generations, so that we can ensure that we've got parents and grandparents for long times. So it's a really good choice to make for our young women.
So it's the easiest way to protect yourself against cervical cancer.
And making sure young people and their families are making choices that are good for them and future-proofing their generations ahead.
So this really shows the importance of how such a simple procedure can be life-saving.